This video will explore primary healthcare, focusing on community health nursing, covering its history, principles, elements, and the structure of the health system. The foundation of primary healthcare is the Alma Ata Declaration of 1978. This event, held in Alma Ata, defined PHC for the first time with the slogan, Health for All by the year 2000. Primary healthcare is defined by the WHO as essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology. It must be accessible and affordable through full community participation. The four principles or pillars of PHC are equitable distribution, community participation, intersectoral coordination, and appropriate technology. Equitable distribution means health services must be equally shared by all people, regardless of their ability to pay or location. The goal is to reach vulnerable groups and correct the concentration of services in urban areas. Community participation involves individuals and families actively promoting their own health. The community should be self-reliant and involved in planning. Examples include ASHA workers chosen by the community. Intersectoral coordination is essential because health requires working with other sectors. This includes agriculture for nutrition, education for awareness, and public works for safe water and sanitation. Appropriate technology involves methods that are scientifically sound, locally adaptable, acceptable, and affordable. For instance, using oral rehydration solution instead of expensive IV fluids for dehydration. The 8 essential elements of PHC can be recalled using the mnemonic: elements, education, local disease control, expanded immunization, MCH and family planning, essential drugs, nutrition, treatment of minor ailments, and safe water and sanitation. Element 1, health education, focuses on educating the community about prevailing health problems, prevention methods, and control. Nurses play a key role in conducting information, education, and communication activities. Element 2 is the prevention and control of locally endemic diseases. This includes vector control measures and specific national health programs targeting diseases like malaria, tuberculosis, and dengue. Element 3 is immunization against major infectious diseases, managed under the Universal Immunization Program. The goal is to reduce child mortality and morbidity. Element 4 covers maternal and child health care, including family planning. This includes antenatal, intranatal, and postnatal care to reduce maternal and infant mortality rates. Element 5 is the provision of essential drugs. These are drugs that satisfy the priority health needs of the population and must be available in adequate amounts at all times and at affordable prices. Element 6 addresses nutrition, focusing on promoting food supply and proper nutrition. This includes correcting malnutrition and addressing micronutrient deficiencies through programs like ICDS. Element 7 is the appropriate treatment of common diseases and injuries, such as fever or minor injuries at the local level. It also includes first aid and referral services for serious cases. Element 8 involves the adequate supply of safe water and basic sanitation, including potable drinking water and safe disposal of excreta, supported by programs like Swachh Bharat Abhiyan. Healthcare is organized into 3 levels: primary level, which is the first contact; secondary level, the first referral; and tertiary level, which provides specialized care. The 3-tier rural health system in India is based on the recommendations of the Srivastava Committee in 1975. The subcenter is the most peripheral contact point, serving a population of 5,000 in plain areas or 3,000 in hilly/tribal areas. Staffing includes an ANM and an MPWM. The Primary Health Center, or PHC, covers 30,000 people in plain areas and 20,000 in hilly areas. It is the first contact point with a doctor, covers 6 subcenters, and is led by a medical officer. The Community Health Center, or CHC, covers 120,000 people in plain areas or 80,000 in hilly areas. It covers 4 PHCs and has 30 beds. The CHC acts as the first referral unit, or FRU. Requirements for an FRU include emergency obstetric and newborn care, blood storage, and specialists like a surgeon and gynecologist. The medical officer at the PHC handles curative services, administration, and supervision of field staff. The ANM at the subcenter focuses on MCH, immunization, and family planning. Village-level functionaries include the Village Health Guide, introduced in 1977, and the trained birth attendant, a local woman trained for hygienic deliveries, both typically serving 1,000 people. The accredited social health activist, or ASHA, serves 1,000 people and acts as a link worker between the community and the health system. They receive performance-based incentives. The referral system is a mechanism to transfer patients from lower to higher levels of care, from the subcenter up to the medical college. It should be a two-way process for follow-up. Ayushman Bharat, launched in 2018, has two pillars. The first upgrades subcenters and PHCs to health and wellness centers. The second, PMJI, provides health insurance up to 5 lakh rupees per family. Health and wellness centers provide comprehensive primary health care. They are staffed by a community health officer, offering services including non-communicable diseases and elderly care. The Millennium Development Goals from 2000 to 2015 included goals relevant to PHC, such as reducing child mortality, improving maternal health, and combating major infectious diseases. The current Sustainable Development Goals, 2015 to 2030, include Goal 3 for good health and well-being, aiming for reduced maternal mortality, ending preventable deaths of young children, and achieving universal health coverage. The Alma-Ata Declaration aimed for health for all by the year 2000, which was the slogan adopted in 1978. A key principle of primary healthcare is appropriate technology, which must be low cost and acceptable, unlike advanced technology, which is high cost and complex. One primary health center in a plain area covers a population of 30,000. For hilly areas, the norm is 20,000. The head of the health and wellness center at the subcenter level is the community health officer, a mid-level health provider. Let's review some rapid-fire questions. PHC stands for Primary Health Center. One CHC covers 4 PHCs and has 30 beds. The first referral unit is the CHC. One PHC covers 6 subcenters. The population norm for ASHA in rural areas is 1,000 people. The 3-tier system was recommended by the Srivastava Committee. Using ORS is an example of appropriate technology. In summary, PHC is essential, accessible, participatory, and affordable based on 4 principles and 8 elements. Key population norms are SC at 3,000 or 5,000, PHC at 20,000 or 30,000, and CHC at 80,000 or 120,000. The CHC is the FRU. Thank you for watching this video. Best of luck with your exams. This scene lists image sources used in the video.